Haiti is the poorest country in the Western Hemisphere. While many people associate Haiti with natural disasters and infectious diseases, cancer is a growing epidemic in the country. The impoverished conditions that many Haitians live in make it difficult to access health care. No one feels this more acutely than women suffering from breast or cervical cancer. Cervical cancer is the largest cancer killer of Haitian women. Breast cancer also kills thousands of Haitian women every year. There are many barriers to accessing care that are unique to women. We traveled to Haiti to find out why women struggled to access care and what was being done. We went to two cities in Haiti, Port-au-Prince and Gonaives. In Port-au-Prince, we looked at how and when breast cancer patients were getting treatment, and in Gonaives, we went to a cervical cancer screening and health class for local Haitian women. In Gonaives, the cervical cancer screenings took place at a relatively new public hospital. Around 70 women gathered to hear the health educator talk about why cervical cancer happens and what they can do to prevent it. For many of these women, this was the first time hearing this information. These educational classes help reduce the stigma of cervical and breast cancer. Women who get cancer are ostracized by their friends, family, and community. One study found that 80% of female cancer patients' partners leave them after their diagnosis because the woman can no longer support them at the same level. Because of this, it is all the more important to educate people on why cancer occurs. The health educator, Holdy, shows them how to do self-breast exams to self-screen for breast cancer, tells them the risk factors for cancer, and how the screenings can prevent them from developing cervical cancer in the future. Many women I talked to after Holdy finished said they felt empowered to take care of their own health and to take steps to live a healthier lifestyle.
Many women arrive at the facilities like IHI, where we visited in Port-au-Prince, far too late to seek curative treatment. In these cases, palliative care is their only option. We asked how many centers are able to provide care in the country.
Only four for the whole country. 3 of them are in Port-au-Prince. So we have St. Luke, we have State University, and we have St. Damien, which is for pediatric oncology, and we have Herbalife. Only that. Only 4.
A small number for a country of 10 million people. At this point, providers expect to see increasing numbers of women who present in the late stages of the disease, where treatment is only able to provide comfort and possibly time, though not much. For cancer treatment, timely diagnosis is imperative. However, recent studies in the country are finding that women are delaying treatment for greater than 12 weeks, in some cases as much as a year, which seriously decreases their chance of survival.
For breast cancer, we have about more than 80% of the patients that come at stage 3 or stage 4 combined. So if you're stage 4, you're non-curable.
We asked what is needed to improve cancer care in the country, and Dr. Bernard had this to say.
Well, to improve, first of all, again, communication, increase awareness so that patient can come earlier. Because if they come earlier, the chance of cure is higher. So we need to reinforce awareness. Second thing is like to have sort of make sure that the program is complete. Because because for cancer, it's surgery, it's chemo, but we still have radiation therapy, and this is a very big problem for us, because if you take cervical cancer, which is sort of the most common cancer among women, mainly needs radiation therapy. So when we have these cases, we're sort of stuck. We don't really know what to do, especially if they come pretty fast. So I think increase the care package if possible, because radiation therapy is very expensive.
These are sentiments shared by those actively trying to combat Haiti's growing epidemic. This is Pia Kebab, a mural in the IHI training room designed by their patients to tell their own story. It describes a tree struck by lightning that loses all its leaves, but the community nurtures Pia Kebab, the capable tree, back to health. Slowly, its leaves start to grow again. It tells the story of hope, even when things look bleak.